Welcome back to On the Pulse, everyone. Well, have I got an interesting interview for you today? We're talking all about your children and summer facts. What we decided to do was send out a call to you, our viewer, to ask us some questions. And of course, we're here with Dr. Andrea Logan, and we're talking all about your kids. How are you, my friend?
Good.
Okay, now you're from Pediatric Associates, and I wanted to ask you, what made you become a pediatric doctor?
Well, when I went to medical school, I did not think I wanted to be a pediatrician. I thought I wanted to be an ENT surgeon.
Really?
I rapidly discovered that I don't like the operating room, and I have sort of this bubbly, silly personality that fits a little bit better with pediatrics. So it turned out that I do much better playing on the floor with the children than operating on people.
Well, I remember when I first met you and I came over and had a chat to you, I thought the same too. I thought you had this great demeanour, and your office also, it feels like that as well. You have a lot of fun in there.
Yeah, we have a good time.
Good. All right, so are you ready for all the questions?
Of course.
All righty. So one of the viewers wrote in, my insect repellent didn't work, and now my child has bites and won't stop scratching. What do you recommend for relief?
So what I don't normally recommend is actually over-the-counter topical Benadryl.
Oh, really?
Yeah, I don't know that it works that well, and we don't know how much is absorbed into the blood when you apply something topical like that. So normally I actually suggest to just do an oral Claritin or Zyrtec because they don't make your baby sleepy, and then perhaps a topical just cortisone, which you can get over the counter.
Is there Zyrtec for children?
There is. There's liquid Zyrtec for children. There's and Claritin, either one. I don't have stock in either of those companies. And some cortisone over the counter. And then sometimes the children will continue to itch to the point where you're worried that infection may be developing.
Yes.
So, and that's become much more common nowadays. So if that starts looking red to you, I suggest put some Neosporin on there and come see me and let me look at it.
All right.
Make sure they're not developing an infection.
Okay, well there's the tip, first one. Second one is, my child has an earache. Is it swimmer's ear, and can I use over-the-counter drops?
So swimmer's ear, it might be. It's summertime. If they've been swimming,
of course,
it could be. It could be a middle ear infection, which is a little bit different. If their ear is already hurting, don't use over-the-counter drops. Those drops are good for preventative because they're an alcohol-based drop. They dry up the fluid, like the water that's in the ear after you've been swimming.
Yep.
But if it already hurts, don't do that because if it's infected in there, it'll hurt.
Oh, really?
So just give them some ibuprofen and bring them to see me, and we'll decide exactly what needs to be done.
Okay, I didn't know that either.
If it really is swimmer's ear, it's a prescription drop they have to have.
Oh, so you actually have to go, even if they've got that. Okay, alrighty. There are so many rashes. How do I know the difference between poison ivy, ringworm, staph, or other rashes? Gee, I hope your child doesn't have all of them together.
You know, sometimes they get all of them together. Nowadays, you know, medicine is always changing. So recently it's become more common for children and adults to have a ringworm that's actually got staph superinfection, which means it's got both infections together. So that stinks, and we have to treat both types of infection. Yeah. In the summertime, plant dermatitises such as poison ivy or any other kind of plant oil can get the skin and cause them to have a big reaction. Yep. Again, really the best thing you're going to do is come see the doctor. But you can Google these things. It doesn't make, I don't get mad at you if you Google something. I Google
everything.
It doesn't bother me.
I'm my own worst enemy.
But if you start diagnosing yourself with terrible things, it's time to come see me. But all those things can happen individually and together.
All right, very quickly, how do you know if a rash is localized or widespread? We have about 30 seconds.
So yeah, localized rash is just, hey, I have this bite, it's got this rash right here.
Okay.
Or if it's all over the body or spreading all over your arms and legs.
So that's widespread.
Right.
I thought that meant what state.
Oh, well, I wouldn't have to tell you twice. You would call.
Whether we're here or in Georgia or somewhere else. You can tell I don't have children, huh? I don't know half these questions. We appreciate you coming in. If you want to find out more information about Dr. Andrea Logan, there it all is up on the screen. Give them a call. She has such great answers. Pediatric Associates. We'll be back after this short break, everyone. You're watching On the Pulse.